last speaker and also a male speaker. Today we know that Grace sharing that their projects help a lot in the COVID-19. And actually, Brett, our last speaker, also contribute voluntarily a lot in COVID. And he is a founder of AOM Group. Let's invite him.
大家晚上好，我是阿乐，来自南非，我在中国快10年了，我是一名医生，儿童临床医学的那个专业，今天可能要用英文的这个分享，所以就是前面就是稍微用中文介绍一下自己，对，我国内的公司叫浙江普拉米医疗科技有限公司，我今天是从温州过来。 非常荣幸让Betty 给我这个平台，给我们分享这个公司。对，那么我们就用英文。Good afternoon and good evening and good morning. I know we have a live stream going on, so I think that's one of the key terms we've been using during COVID. Everyone has been saying good morning, good afternoon, good evening, right? So yes. Thank you everyone for this opportunity to speak to you today. My name is Brett. I'm from South Africa, and I'm going to be introducing you to our company. We're a medical group called Alpha and Omega Group, and we're based in South Africa and also in China. Yes. So I'll just be going through a few areas to introduce our company to you. So basically, at the moment, our group is divided into 3 functions. We have a MedTech company, which produces and distributes medical devices and products, and we have a foundation, a charity foundation, which we've worked with multiple partners, especially during COVID-19, and we have a digital medicine platform, which is a platform for research and healthcare innovation, going from a laboratory experiment to a proof of concept, and hopefully to get great patents and introduce more talents in healthcare. So just to give you a background of why our company exists, I'm sure that you all know Africa on the 1st of January 2021 opened up the African Continental Free Trade Agreement, which now makes Africa's economy opening up to be the biggest free trade area in the world, with an estimated more than 3 trillion USD per annum. However, I don't know if you knew that, but because of poor healthcare service delivery in Africa, it costs the same amount in damages every year, 3.5 trillion USD. So if a company is really positioned to improve service delivery in African healthcare, they could potentially double this AFCT economy. Actually the person to doctor ratio in Africa is not so bad, it's quite good. And our platform currently has access to around 20,000 alumni of life scientists that use some of our work that we've been doing. And as you know, Sub-Saharan Africa is the largest growing population, going to 2 billion by the year 2050. And we are also the youngest population per capita. So people under the age of 24 years old in Africa, they're the highest concentration. So it's definitely an excellent market to invest in and to think about. Currently, 100 medical device companies use our services, especially during this last 1 year. So I'm not going to go too much through these, but just want to quickly show you, our team, amazing people that we're working with from over 15 African countries. We have 26 members at the moment, and we have a large team of interns that we work directly with universities in China that have life scientist interns that we recruit to our platform to give them personal development and also for them to get involved in the healthcare space. I'm a medical doctor, as you know, and I represented our company at the 2018 Forum on China-Africa Cooperation, at the China-Africa Roundtable Leaders. And yeah, I know some of the people here, and we were the OTEC winners in 2020, and we received our first batch of funding here in Beijing. And yeah, we've been growing steadily since then. Some of our milestones, last year we were invited by the President and the members of the Chinese Communist Party to attend the National Commendation on COVID-19 ceremony. We've got our first pilot in Ghana for medical devices, and we have some great partners in the Zhejiang municipal government as well as South African healthcare services. So yeah, I mean, my background is different to the other speakers because I was a medical doctor, and now I'm a medical, should I say, MedTech entrepreneur, or on my way to be there. And it's not easy. Yeah, med school is not a joke. You really have to put in time. And I had the opportunity of working at our hospitals in Zhejiang as well as in Australia. And yeah, that's basically it. This was our meeting at POCT 2018. And that's where we hope to continue to do more work between the China-Africa healthcare space. Yeah, this year we had the wonderful opportunity of attending the COVID-19 vaccine symposium rollout. This man here is the chair of the COVID-19 research division in South Africa, Professor Shabir Mahdi, and these are also some of the world's leading scientists. This man is the founder of the WellCare group in Britain, and yes, this is our lab for our Chinese company, and this is our main research engineer, Dr. Confidence Dodoi, and yeah, we have some great sponsors and people who support us. This is Dr. Zhang Wenhong and myself. We were selected to speak at the World Young Scientist Summit in 2020 in Zhejiang, and this is some of our alumni who has been working on front lines in Africa, and our company was helping them to supply most of the medical supplies. We had an opportunity to listen into Dr. Tedros at the COVID-19 symposium, and it was an awesome opportunity for my team to listen at what the world leaders are doing in healthcare and try to also to be a part of it. Yes. So yeah, this is our focus is to try and implement our company as a main driver for China-Africa healthcare. And this was the meeting that we've had in 2018. And this year it will be going on again. And so we encourage anyone here to support us in realizing excellent healthcare for the African population. So I want to ask you a question. How many of you had a PCR COVID-19 test? 核酸 谁有没有做过的核酸? Okay, yes. Can I ask you how much you paid for your test?
I forget.
About 120 RMB, right?
Yeah.
And how long did it take you to get your result?
Within 24 hours.
Within 24 hours, right? So usually if you do a PCR test, it takes about 8 to 12 hours to get the result. So our company developed a test kit that gives you the results of your COVID-19 presence of the virus within 10 minutes. Within 10 minutes. Actually, the reason why in China the PCR is very cheap is because the Chinese government actually subsidizes the cost. So they've done a great job. But in my country, it costs $50 to get a PCR test kit. And this test kit that we've developed just costs $5. So it's one tenth of that price. And I think that's why the problem is during COVID-19, a lot of medical device companies actually took advantage of the situation and hiked their prices up, and it destroyed economies, and still people are not recovering from it. So this is one of our major tests. I met a person from the Embassy of Netherlands. We actually sold these in Netherlands, actually. Yeah, because our test is a CE approved test. Yeah, it's a CE approved test. But also in the medical device industry, it's very different because different countries have different regulators, and it can become very difficult if you are also a startup like ours. We're an early to mid-stage startup, and it's not like we have 100 million RMB to just pay someone to do an FDA license. So I hope in the future that we can try and improve the way that we go about policy making and the speed in which we can get things done, because this will really help opening economies. For example, if you need to open your school and your students need to go back, you'd rather do this test if you're having COVID symptoms than paying $50 for a PCR test. So I think this is a good way of using a first screen to get that done. So that's like our main product that we've been working on. So that's our MedTech company. This is the test kit. It's almost 97 consistent with the PCR test. This is an antibody test kit that we've provided, and this brand is from our company in Zhejiang. We've also been working with Shanghai Fosun Group, and we are working with them on their current PCR test kit, which is WHO approved. We've also done a lot of work in social work, and we've donated over 500,000 pieces of PPE to South Africa. And we've also donated we are in the process of donating 100,000 rapid antibody test kits in South Africa. So this is our digital medicine program that we are busy working on. So anybody in digital healthcare or telemedicine would love to speak to you afterwards and try and see if there's any areas of cooperation. This is one of our first research projects that we did on Sub-Saharan African malnutrition that actually got us to where we are here today. So we really spent time on excellent research proposals and projects. And our hope is that the next Nobel Prize in physiology or medicine comes from a product of our work. Thank you so much.